Wrist girth measurement is taken as a figure of 8 measurement. What are the steps for wrist girth measurement? The medial aspect of the wrist just distal to the ulnar styloid process is used as the starting position. So this ulnar styloid process is taken as the starting position. Second step is to cross the inch tape or the measurement tape across the wrist joint and reach the radial styloid process from the anterior aspect of the wrist. Then in third step we will cross the measurement tape across the hand and reach the fifth metacarpophalangeal joint. Then from here we will cross through the ventral surface of the hand, that is anterior surface of the hand, and reach the second metacarpophalangeal joint. Then the measurement tape is brought across the dorsum of the hand to the starting position. So you can see here it gives a figure of 8 structure while measuring this wrist girth measurement. Therefore the name is called as figure of 8 wrist girth measurement. Let's see the video demonstration. First starting position is the styloid process of the ulna. Then the inch tape is taken towards the styloid process of the radius. From here, the inch tape will be crossed across the hand and reach the fifth metacarpophalangeal joint. So from fifth metacarpophalangeal joint, the inch tape is crossed across the hand and reach the second metacarpophalangeal joint. From second metacarpophalangeal joint, the inch tape is taken to the starting position, that is the styloid process of the ulna. So this is the measurement technique for wrist and hand, and it is called as figure of 8 measurement technique. This is mostly used to see the edema over the hand and the wrist. Next, coming to ankle girth measurement, which is also similar to wrist girth measurement. Here too we use the figure of 8 technique. So what are the steps to measure ankle girth measurement? First, the measuring tape has to be placed midway between the tendon of the tibialis anterior and the lateral malleolus. Then the tape is pulled medially towards the tuberosity of the navicular bone. From there it is crossed across the arch of the foot and the measuring tape reaches the fifth metatarsal or the base of the fifth metatarsal bone. From fifth metatarsal, the inch tape is brought towards the tibialis anterior tendon. It crosses the tibialis anterior tendon and reaches the distal part of the medial malleolus. From medial malleolus, the inch tape is crossed across the Achilles tendon, circling around the ankle, and it reaches the starting position, that is midpoint between the lateral malleolus and the tibialis anterior muscle. So let's see the video demonstration. So you can see here the starting position is midway between the lateral malleolus and the tibialis anterior tendon. Then the inch tape is taken towards the medial aspect of the foot, crossing the navicular bone. From there, the inch tape is crossed across the arch of the foot and reach the fifth metatarsal or the base of the fifth metatarsal. From there, the inch tape is brought towards the anterior aspect of the ankle and cross over the tibialis anterior as well as the distal aspect of the medial malleolus. Then it crosses over the Achilles tendon and over the lateral malleolus and come to the starting position. So this is the technique to measure the limb girth or the ankle girth measurement by figure of 8 technique. Next is the calf girth measurement technique. So for calf girth, the subject has to stand erect with their weights evenly distributed between both feet. The measurement is taken at the level of the largest circumference of the calf. Next is the thigh girth measurement. For thigh girth measurement, the subject has to stand erect with their weight evenly distributed between both feet. Then the midway or the midpoint is taken between the greater trochanter of femur bone and the lateral condyle of the tibia. So you can visualize here the instep is placed at the greater trochanter and at the lateral condyle of the tibia. Then the midpoint is taken between these two reference points and the girth is measured. Next is gluteal girth measurement. So gluteal girth measurement is taken at the level where the gluteal muscle protrudes the most. The subject has to stand erect with their weights evenly distributed between both the feet, and we have to make sure the recording has to be perpendicular to the spine, and also it should be flat on the skin surface. So you can see in the video here the instep is placed at the level where the gluteal muscle protrudes the most, and then the measurement is taken. And we have to make sure that the tape is lying flat on the surface as well as it has to be perpendicular to the spine. Next measurement is for trunk measurement, and the first one we are going to observe here is for waist girth measurement. So the waist measurement is taken at the narrowest waist level, and it should be taken after the patient performs the full inhalation and exhalation. So the measurement should be taken after full exhalation. Now if we are unsure that this measurement was taken at the narrowest level, several measurements has to be taken at different levels. So one can be just above the narrowest level, one at the narrowest level of the waist, and third we can take just below the narrowest level or at the level of the umbilicus. When recording, we have to make sure that the tape is lying flat on the skin surface and it has to be parallel to the ground and perpendicular to the spine. The last measurement technique is for the chest girth measurement. So it is taken at the level to the mid of the sternum with the tape passing under the arms. Then we'll ask the patient to inhale and fully exhale. So after the patient completes a normal exhalation, we will take the measurement. So when recording, we have to make sure the tape is lying flat on the skin and horizontal to the ground and perpendicular to the spine. So these were some of the girth measurement techniques which we have discussed today. First one was for the arm measurement, second one was for the forearm measurement, third was for the wrist girth measurement, fourth was for ankle girth measurement. Wrist and ankle girth measurement is measured by figure of 8 technique. Then calf, thigh and gluteal area measurement also can be taken with the inch tape. Then for trunk measurement, we can take the waist measurement and the chest girth measurement. So we have completed the theoretical theory for limb girth and limb length measurement. Next, we will be moving on to practical demonstrations and practice for limb girth and limb length measurement by the students, for which I will be sharing a video demonstration of all the measurement techniques, and when the practical classes are assigned, we will be practicing those techniques as well as perform the demonstrations. Thank you.